Nicotine and addiction. So what percentage of smokers are able to successfully quit each year without assistance? Is it 3%, 10%, 50%, 65%, or 97%? And the answer is 3%. And this is why it's so important to address this as part of our services in addiction medicine. So most smokers are eager to quit, actually, approximately 70%. 40% attempt to quit each year, and only about 2 to 5% are successful without assistance. Between 2000 and 2015, there was a modest but statistically significant increase that occurred in the prevalence of past year quit attempts, from 49 to about 55%, including recent smoking cessation of 5.7 to 7.4%, receipt of healthcare professional advice to quit smoking between 52 to 57%, and use of cessation counseling or medication between 21 to 31%. Use of cessation counseling and medication increases quit rates pretty substantially, especially when they are combined. And combining behavioral and pharmacotherapy interventions increases cessation by 82% compared with minimal intervention, or what we call usual care. So just saying, well, it's really important that you quit smoking, and then leave it at that. So what are the different methods of use? Well, there's inhalation through cigarettes, cigars, pipes, and this releases a high-dose pulsatile delivery of nicotine and has the overall greatest negative effect on health. They can also consume nicotine by chewing, through snuff, chewing tobacco, chewing tobacco delivers high levels of nicotine to the venous blood supply compared to cigarettes. And this causes modest levels of increase of cardiovascular disease or cancer as compared to cigarettes, particularly head and neck and mouth cancers. For minimal cardiovascular effects for nicotine replacement therapy, this would be the patch, gum, lozenges, inhaler, or nasal spray. And then e-cigarettes, it can be used for harm reduction potential, but there's really not enough long-term data out there, and particularly when people are introducing different substances or vaping into their e-cigarettes, that's when it can be particularly harmful, as we saw with those synthetic THC. Nicotine reaches the brain within about 7 to 10 seconds of inhalation and binds to the alpha-4 beta-2 subunits. And this releases dopamine, causing that pleasure sensation. The receptors quickly become desensitized within minutes and cannot function temporarily. When receptors resensitize to the resting state, it initiates this craving due to the lack of release of dopamine. And this resensitization is in about 45 minutes when smokers tend to need their next cigarette, so need to have that additional smoke break during their workday or at home. Nicotine is extensively metabolized in the liver and the CYP2A6 system, and to a lesser extent in the lungs and brain. About 80% is metabolized to cotinine, and 17% of that is excreted unchanged in the urine. The nicotine half-life is about 1 to 2 hours, and the cotinine half-life is about 16 hours. Blood, salivary plasma, and urine cotinine are commonly used as biochemical markers of nicotine intake. And in terms of value, it's usually greater than 14 nanograms per milliliter. That indicates that they're smoking. For most regular smokers, you're going to see a level between 250 to 300, and this can persist up to 7 days after cessation. And I've seen some different surgeons, particularly orthopedic surgeons, use this mechanism to test patients because they really want them to have stopped smoking prior to elective surgical intervention to decrease their risks and improve healing after that. Smoke contains aromatic hydrocarbons that induce the CYP1A2, which lowers levels of many medications. And it becomes an issue when patients quit smoking or when they're hospitalized and then released. It can have a drastic impact on medication regimen tolerability as well as effectiveness. Levels can get dangerously high, particularly theophylline, clozapine, and methadone, and levels can get high but not always dangerous in other medications such as alprazolam, duloxetine, and zolpidem. And cigarette smoking increases the risk of stroke and premature myocardial infarction in women when combined particularly with oral contraceptives, so sort of anything that contains estrogen. In low doses, nicotine acts on sympathetic nervous system, so acutely increases the blood pressure, the heart rate, cardiac output, and causes cutaneous vasoconstriction. In higher doses, it causes ganglionic stimulation and the release of adrenal catecholamines. Primary CNS effects are usually arousal, relaxation, enhancement of mood, attention, and reaction time, and some improvement of performance and behavior results from the relief of withdrawal symptoms. There is a really high rate of relapse in individuals who try to quit smoking. 70% of adults who smoke want to quit, about 40% have tried to stop at least once in the prior year, and 5% succeed overall without assistance. And it is a very powerful addiction. Even after an MI, COPD, laryngectomy, cancer, and other medical sequelae of smoking, greater than 50% revert to cigarette use within days or weeks of discharge from the hospital. So what does withdrawal look like from tobacco use? Tobacco use is sustained in part by the need to prevent nicotine withdrawal symptoms. It's generally an overnight cycle. It follows with the symptoms of cravings, irritability and anger, anxiety, depression, difficulty concentrating, restlessness, as well as increased appetite. And the symptoms are distressing but not life-threatening. Acute withdrawal symptoms generally reach a peak in about 24 to 48 hours and gradually diminish over the next few weeks. Dysphoria, anhedonia may last for a few months, and the extinction of tobacco-associated conditioned cues generally require months to years.